The bronchial tree represents a highly ordered branching network designed to distribute air evenly throughout the lungs. As airways branch, their diameter decreases dramatically while total cross-sectional area increases, reducing airflow velocity as air approaches the gas exchange regions. This branching architecture is essential for efficient diffusion and minimizes turbulence in distal airways. The questions here emphasize clinically important features such as airway reinforcement, epithelial specialization, and bronchopulmonary segmentation. As you think through them, consider how airway structure both enables normal breathing and limits pathologic collapse, obstruction, and even spread of infection. The trachea is approximately 4 inches long and extends from the larynx to its bifurcation at the carnea. It's or the at the carina. Excuse my language. It's reinforced by C-shaped hyaline cartilage rings that maintain airway patency while allowing flexibility. The posterior opening of these rings accommodates the esophagus, permitting expansion during swallowing. This design highlights how respiratory and digestive systems are anatomically interdependent. Looking at the layers of the tracheal wall consists of three, actually four layers. And we'll look at that here. The mucosa, the submucosa, the musculocartilaginous layer, and the adventitia. The trachealis muscle spans the open posterior ends of the cartilage rings and contracts during coughing. We can see this muscle layer here. When it contracts, it will narrow the lumen to increase airflow velocity. The layered organization of the trachea allows it to be rigid enough to stay open, thanks to this cartilage ring in a horseshoe shape, but dynamic enough to participate in airway clearance. So this is something for us to think about. Cartilage reinforcement prevents airway collapse during inspiration when intrathoracic pressure becomes negative. So why is it important the trachea is reinforced with cartilage? Well, it's because it prevents collapse of the airway. Why is it important that cartilage exists as rings and not contiguously a rigid tube? Well, the ring shape of cartilage, rather than a rigid tube, allows for flexibility and posterior expansion of the esophagus. And why is it advantageous that these rings are incomplete posteriorly? Well, because incomplete posterior wall also allows for the trachealis muscle to modulate airway diameter, which illustrates how structural imperfection actually is better for function. Looking at the trachea's histology, the trachea is lined with pseudostratified columnar epithelium that have tons of goblet cells. This epithelium is specialized for mucus production and coordinated ciliary movement. Beneath it, the lamina propria and submucosa contain glands and immune cells, reinforcing the trachea's role as both a conduit and a defensive layer. Mucociliary clearance is one of the respiratory system's most important innate defenses, or innate defense mechanisms. Goblet cells and submucosal glands produce mucus-rich mucins, antimicrobial peptides, IgA, and water. Cilia beat in a coordinated wave, moving mucus towards the larynx to be swallowed. During inflammation, mucus becomes thicker and harder to clear, increasing infection risk, which is a key feature of chronic bronchitis and cystic fibrosis. When we come back, we're going to look at the bronchial tree and how it branches.